we are seeing an increase in cases across the reservation. And as you mentioned, we span across North and South Dakota. And so we rely heavily on, good leadership from both states, and their decisions impact our communities heavily.
Yeah, I got to imagine that even if the reservation is distinct in terms of its governing structure and its sovereignty, it is, inevitably intermingled with the rates of community transmission in the folks around you.
Exactly. We rely on outside communities for shopping. People work off the reservation. We have off-reservation people that come onto the reservation to work in our schools and our healthcare system. So we're very much intertwined with those communities. I think my frustrations as a public health professional is that we really need leadership to be following the science and to be following the expert guidance on how community members can do their part in addressing the spread. And we've just not been effective at doing that.
Let me ask you this. In New York in March and April, which was basically the worst outbreak in the world at that point, and probably still, maybe city in Ecuador here or Brazil here and there, but at that point the worst. It got really bad. People were inside. They heard the wailing sound of sirens all the time. 1 out of every 400 New Yorkers died. And it traumatized people. I mean, they were traumatized. They knew people that got sick. They knew people that died. And they were like, this is awful. What is the social life world experience of this pandemic on your reservation and in those states now as the numbers per capita head towards New York levels?
Well, I think it varies. We have, especially in North and South Dakota, we know that there has been major resistance to, wearing face masks. There's been a debate about their effectiveness and whether they're, even work, and suggestions that maybe they're even harmful to our health. And so we have that attitude, but we also have, I think within our reservation communities, we do have people that are taking this virus seriously. They know that we are losing precious lives. They know that it's important for them to do their part to reduce the spread, and that has been what we've focused on when we're educating our communities. It's about doing things for the greater good. It's about making good choices, being a good relative, doing everything that we can to make sure that our communities stay safe and healthy, but we don't see that across the 2 states that we share territory with.
What is the healthcare capacity that your tribe and reservation has?
So we do have an Indian Health Service facility. It is a 12-bed hospital, but we definitely have reached capacity several times during the pandemic, and we rely heavily on outside healthcare facilities to meet those higher level of care needs for our patients. And so when we talk about the healthcare capacity across North and South Dakota, that is scary for us too, because we rely on those healthcare facilities, and when their capacity is dwindling, we know that we're going to have to be searching farther and farther for our community members to have the level of care that they need. And we're disproportionately impacted by this virus. We have, higher rates of the pre-existing conditions that put us at risk of developing complications, and so this hits us hard. When our people are getting sick, they're getting really sick, and they're needing those higher levels of care.
All right, Tasha Peltier, who works in the Standing Sioux Tribe there in North and South Dakota, thank you so much. I really appreciate it.
Thanks.
That is all in this evening. The Rachel Maddow Show starts right now with Ali Velshi in for Rachel. Good evening, Ali.